everyone, and welcome to Module 9, Day 1. This week, our main focus is going to be on medical emergencies and assisting in those situations. So what that means is that we will be focusing on only one chapter this week, Chapter 43. This week, we will also be having a special guest all week, both days. We're going to have a guest teacher from a group called Heart Solutions. With them coming from Heart Solutions, they will be teaching you CPR and first aid. So by the end of the week, you will be certified in both of those. So as we start this week out, please make sure that you arrive on time to class at 8 a.m. That will make completing their tasks a little bit easier, especially because CPR and first aid can take a good majority of the class time itself. So please make sure that you arrive on time so we can get started right away. So like I said in the beginning of the video, this week we are focusing on medical emergencies, which is Chapter 43. As well as the medical emergencies, we're also talking about your responsibilities during those situations. As a medical assistant, you will need specific training in areas to make sure that you are prepared. Every area of a hospital or a clinic will be different, so your training will be a little bit different. But you will get that training before you start working on the job. Anytime that there is any type of an emergency, you always want to notify your physician right away if you can. You know, that's the first person you want to go to is your physician, and then you want to make sure that all of your patients and family members and other staff are safe. In an emergency, you may need to, depending on the severity of it, contact other emergency service personnel. Those could be people such as the emergency medical responders, the emergency medical technicians or EMTs, advanced medical technicians, or paramedics. So typically an EMT or a paramedic will come on a rig or an ambulance, but sometimes we have to contact other people as well. When we start talking about medical emergencies, one thing that we need to discuss and go over again is the Good Samaritan Law. Now, this isn't the first time that you've heard me bring up this topic, but we are going to discuss it a little bit more in depth this time because when you're doing things like CPR and first aid, the Good Samaritan Law definitely comes back into play for you guys. So this law was established to encourage healthcare professionals to volunteer in emergencies without the fear of financial liability. So what that means is, you know, if you see somebody and you are out in the field, or maybe you're out shopping at Target or, you know, Kohl's or something, and you see that somebody needs emergency help, your gut instinct should be to help them and not have to worry about them suing you if something goes wrong. So again, generally this does apply just inside of the facility, but it could also apply outside the facility. Maybe you're driving down the road and you see an accident and you stop to help somebody. That can be where the Good Samaritan Law will fall into place as well. It's a safety net for us as medical personnel, but it's also to help us so that way we know we can act and help others in the time of need. As a medical assistant, you have three primary legal responsibilities in any certain emergency. The first thing that we need to be responsible about is acting within our scope of practice. So remember that you are accountable for you. You're also accountable for your employer and the public as a whole. If you are going to do something and you know that you do not have either the medical training for it or it is outside of your scope of practice, do not do that. Find someone that can. The second is to make sure that you ensure and document the constant emergency readiness of your office in which you work. So that might be maybe that you have to do drills every month, or maybe it's every other month. Checking your supplies, making sure that nothing is expired, making sure that whatever happens in any sort of emergency, you're ready for that. And the third and final responsibility is to do all that you can to prevent these emergencies. So the biggest thing that we try to do in order to prevent an emergency is to have an emergency preparedness plan. Having a plan in place helps you to be more responsible, helps you to be more ready for any sort of situation that may come about. There are some guidelines for providing emergency care. Now, as a medical assistant, you must stay up to date on the emergency plans of your office or facility and the community. Things can change very rapidly depending on what the situation is. Maybe you have a situation and that makes your emergency plan have to be different. Those are things that you need to make sure that you are always ready for, you're always prepared for, and you know what could happen. You also need to be able to handle emergencies that come in three main types of situations. One way is over the phone. So this is actually the most common of the three types of emergencies. This is where you need those triage skills and where those will come into place. What I mean by triage is that you are able to assess and prioritize the emergency care needed by patients in the most appropriate way. If your patient calls in and says that they are having chest pain and they're at home alone, the appropriate thing would be to not hang up on them, stay on the phone with them, and then try to get help to them. Have another coworker call EMS. Another thing that could happen is maybe you have somebody calling in and they're threatening you, and you need to be able to take, that phone call and be able to maybe put a preparedness plan in place in case that patient does follow through with something. You also need to worry and know about emergencies near or at a medical office. For example, maybe you're working out at one of the clinics that was near the mall and there was, those shootings that have happened there. Those are things that you need to be aware of because while they're not directly related to your office, they are something that could come to your office depending on the situation. And the last one is any sort of emergencies that can happen inside of the office, whether that be that you have maybe an active shooter situation, maybe you have a child missing, or a patient has a heart attack or something to that nature inside of the office. You need to have that emergency plan in place so you know how to handle that situation. Now, every doctor's office will have what we call an emergency crash cart kit. They're available for all situations, and it will contain all supplies that may be needed during an emergency. It will be instantly accessible and easily accessible to all people in the office. With a crash cart or close to it, maybe you have just an emergency kit or a drug box, but you'll always have the emergency crash cart and drugs or some sort of medical drugs that are needed, emergency drugs. Some of the drugs that you might see on a crash cart are things like activated charcoal, maybe you see Benadryl, epinephrine, you could also see insulin, lidocaine, nitroglycerin, normal saline, adrenaline, verapamil, anything that could be used to help your patient during a situation. Okay. So now that we have had some fun and we've discussed some of the medical emergencies and how you might encounter them, we need to talk about, because we've actually talked about the preparedness and the planning for it, now we're going to talk about some of the emergencies that you might deal with. Now, because Heart Solutions is coming into the class and they're going to be teaching you the proper way to perform CPR, I'm not really going to discuss that in the video for this week. So if you would like to bring something with you to take notes during your CPR training, that is perfectly fine. But again, please make sure that you arrive to class on time for that training. One thing I do want to talk about is respiratory distress. So this could be a reaction to long-term diseases such as COPD or asthma. It could be due to any sort of an emergency situation. Maybe they've had anaphylactic shock or they're having an allergic reaction to a medication. As a medical assistant, you need to be able to recognize the signs and symptoms that are there for respiratory distress so you can help when you see those. Some of the signs and symptoms are acute anxiety with gasping breaths. Maybe the patient has bradypnea, which is where they have slow breathing, typically less than 8 breaths per minute. They could be cyanotic, or they could have a blue color to their face, lips, nose, and fingertips. Maybe they're having a failure of their chest to rise and fall. They could have nasal flaring or noisy breathing, and they could have what we call tachypnea, or an abnormally, maybe they're breathing more than 24 breaths per minute. They're shallow, they're going very fast, so they're typically like, okay? If this does happen, you may need to administer oxygen to your patient, so please be aware of that as well. Another thing is chest pain. So heart attacks are typically, and always have been, the leading cause of death for both men and women. As a medical assistant, you need to know the signs and symptoms of chest pain so you can prepare for it and help with that. Typically, the pain is going to be in the middle or the left side of the patient's chest, and it will be described as a sharp, stabbing, crushing, squeezing, or aching pain. The pain may also radiate down the left arm to the upper back or up the neck. Now, for women, it is a little bit different. It is not their left arm typically. It is typically their right arm. If a patient, again, calls you from their home and says that they're complaining of chest pain, do not let that patient off the phone. Keep them on the line. Have another coworker call 911, and you stay with that patient until the EMS comes and takes over. You want to always write down your patient's name and location, and again, you may need to transfer that information to the EMS that have arrived. The last medical emergency I'm going to talk about for today is shock. Now, shock is when you have a collapse of your cardiovascular system. Could be due to maybe something cold, learning of news, something to that effect. Typically, shock is caused by an insufficient cardiac output. And the signs and symptoms of shock include weakness, rapid heart rate, they could be thirsty, they could be cool or clammy to the touch and have kind of pale complexions, very pale. They could be confused, they could go unresponsive, and they can have nausea. Okay. So that is all I have for you guys on this day 1 video. Again, please make sure that you do arrive to class on time. I would prefer that if you would be there a little early so Heart Solutions can help kind of set up and get going, and then we will have you guys get certified in CPR on day 1. We'll work with some of the other medical emergencies that you could be responsible for. Please make sure that you read Chapter 43 so you are prepared for class this week. And then I will see you guys on day 1 of week 9. Bye, guys.